COVID-19 has caused healthcare providers to think about the future of patient care and even architecture. This is the Centre Pompidou, which opened in 1977 and is considered a symbol of modern architecture here in Paris. So what do hospitals of the future look like? How do you treat patients on a mass scale with an infectious disease? And how do you also address non-COVID related backlogs created by a global pandemic? I spoke to the head of Obstetrics and Gynecology at the University of Bologna Hospital in Italy, and also the Chief Information Officer at the Luton and Dunstable University Hospital in the United Kingdom, to get a better sense of how all this is going to play out. What is your biggest fear as the head of obstetrics here in Bologna?
The preoccupation that we have now is that the system will have to change in a way, because very simply the hospitals were not built to avoid spread by droplets. As you have probably seen, hospitals in Italy, the architecture is not very new. They are quite old. So there are rooms that contain many patients. In many settings, like in our own, you don't have a bathroom for every room, which is a major inconvenience. And of course, if you have an epidemic, that will represent potentially an increased probability of spread of the disease. So the architecture of our hospitals will have to change, which is a problem because it requires a lot of investment. There will be a need to restructure the architecture that we have, but it will not be done in a short period of time.
So looking longer term, when new architecture can be implemented, what does the hospital of the future look like?
Well, to make an example, I mean, this hospital is undergoing a renovation. They were supposed to start work to build a new wing when the epidemic spread, so that was stopped. But now the plans that we made for the hospital will have to be changed, because we will have to have larger rooms. We will need to have a section in which there are people that we can isolate, where we can provide negative air pressure, so we can renovate the air more easily. Wings area within every ward where you can maintain people in isolation, and all these must be taken care of, which is very difficult. And if you ask me how we are going to do, we are discussing, and I don't have a solution right now.
You're still trying to figure it out.
Now what we are thinking is, how can we manage with the hospitals that we have now, because we cannot build a new hospital in 6 months, How can we manage that we can take care to keep people far apart, the one for the other, that we allow a bathroom for each of them, and we can maintain the precaution that we had for all the time.
A shorter-term solution to hospital infrastructure requirements in the near term is currently being used in the UK and is a concept called expandables.
Philippa, what is an expandable? What does it look like? What is its function?
Well, it's a trailer that has an additional part to it, which is deployable at the press of a button, and it is able to offer you a much larger footprint for you to have circulatory space and additional room to do things, but it has the advantage that it can go back to its original size. So it's the same technology in an expandable box.
And what is its function when it comes to medicine and being deployed to hospitals?
Well, the hospital space is confined in most places. We have 1940s build hospitals and their thoroughfares are still very narrow. So we are able to deploy it anywhere, and it is able to give us the ability to expand our imaging capacity. In this instance, it's about imaging. So we have MRIs, we have CTs, breast screening. All of those can be placed on a mobile van, but the circulatory space has never been good for those, and now we're able to put any of those into an expandable technology case and deploy that, and then have the additional space for the patient, which is a real bonus.
How much flexibility now do these expandables give doctors, radiologists, clinicians under a pandemic, under an infectious disease environment within an expandable?
So the rules on infection control is you have to have a thoroughfare where you separate clean from dirty, you separate patients and staff. And if somebody has a known infection, and it's quite common for patients just to have MRSA, some of us carry that normally, but if the patient's been identified and swabbed as positive, we need to clean everything down after we've done the investigation. And staff need the space to maintain distance, but to also practice good hygiene, to wash their hands continually, and to sometimes put on gloves and masks and aprons if needed. The expandable gives you clean and dirty space, so you're able to maintain the safety element of the patient whilst also maintaining the flow.
Philippa, I really appreciate your insights today on what is quite an interesting subject, especially as we look to the future on COVID-19 and non-COVID-19 cases.